aking mga pagsubok, kayo'y laging tumutok.
PCOS, or Polycystic Ovarian Syndrome, is one of the most common causes of female infertility in the world. In fact, 1 in 10 women of childbearing age have this hormonal disorder. But despite how common it is, there are still misconceptions about the condition that have to be addressed. On the program today, we hope to shed some light in dealing with PCOS and debunk myths about it. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk on CNN Philippines. PCOS is a condition in which women produce abnormal amounts of male hormones or androgens, and as a result, more challenging time getting pregnant. They're also at increased risk of developing other conditions like diabetes and high blood pressure. But learning how to manage PCOS can help reduce its symptoms and prevent long-term health problems. So let's welcome our guests for today. With us is Dr. Sonia Desquitado. She's an obstetrician gynecologist from the Asian Hospital and Medical Center and a fellow at the Philippine Society for Reproductive Medicine. Also with us is Dr. Jeremy Robles. He's an endocrinologist from Chonghua Hospital in Cebu and the immediate past president of the Philippine Society of Endocrinology, Diabetes, and Metabolism. Now, PCOS still isn't fully understood on what causes it, but research suggests that women with a strong family history of the condition are more likely to have it. I'll start the conversation kay Dr. Sonia. So, if a woman is diagnosed with PCOS, ano ang mga chances, doktora, na yung anak niyang babae or maybe yung kapatid niya ay may PCOS as well?
Actually, that scenario is very common in the clinic, no? Because, by definition, PCOS is a syndrome. So patients, when they are young, patients with a family history of diabetes and hypertension, the women in the family have PCOS, and usually it's the sisters have it, no? And if you ask them, the mother had it, and the parents maybe, or the lola or the lolo are also diabetic and hypertensive. So yes, it's very common that women in the family have it.
Now, apart from genetics, there are several environmental factors din naman that can trigger this condition. Dr. Jeremy, tell us about these.
PCOS is really quite an interesting disease, no? So it's quite complex in the sense that it does manifest in different ways. But we know for a fact that genetic factors really play a big role here. But when we talk about environmental factors, obesity is one of the things you want to avoid if you're at risk with PCOS, and therefore you have to stick to a strict diet just to keep your patient's weight in check. Ethnicity also plays a role. Depends on if you're Asian, and even if you're in the U.S., you're still at risk. You have a higher risk for the metabolic disorders of PCOS.
Aside from yung mga common thoughts about PCOS na this is one of the main causes of infertility, it can also cause a lot of metabolic problems as well.
Remember that a lot of these patients, when they go into the clinic, their main issue is infertility, but often when you do check them, they are at risk for diabetes, obesity. They may also have derangements with their blood pressure as well as their cholesterol. All of these metabolic cascade may be present in our PCOS patients.
Now, some of the risk factors as well include trouble with weight gain or weight loss. In fact, when either of the two are coupled with irregular menstrual periods, your doctor will usually suspect PCOS. Dr. Sonia, when a patient comes to you initially with their concern and then you eventually have a diagnosis of PCOS, what do they normally complain about?
More often than not, it's usually irregular periods. No, but when you say PCOS, before to diagnose PCOS, in 2 out of 3 criteria. Number 1 is the irregular periods. Also signs of an ovulation, they don't ovulate regularly. Some of them don't have periods at all. No. And then you'll have hirsutism, hyperandrogenism, increased testosterone in the body. So mabigote, mabalbon, no? Some of them will have oily skin and acne, so signs of increased androgens. And also, of course, on transvaginal ultrasound, you'll see polycystic looking ovary. So to diagnose PCOS, you need
Sonia, a lot of the women with PCOS actually go undiagnosed. So they go through the symptoms, they go not really thinking about PCOS initially. Why do you think this is the case? Are the symptoms difficult to nail down initially because they don't interfere with daily life that much?
PCOS does not manifest fully in all patients. No? So usually in patients who are lean, who exercise, who eat well, they can have PCOS, but it's not a problem because their periods are very regular. They are delayed 1 or 2 days, but they will get a period every 1 to 2 months, and it does not bother them. So usually they will not go to the clinic.
Living with any disease or any medical condition for that matter never comes easy. Now, aside from the physical symptoms women with PCOS experience, the condition can also impact their mental health. Dr. Sonia, ano naman kaya yung mga struggles that women with PCOS may face with regards to their mental health?
PCOS women who are married, that is their greatest frustration. So usually it's not being able to conceive a child. And then even when they are young, they go to the clinic or they're planning to get married, they ask, Doc, can I have kids? So that is one of their main problems that they tell me. But usually if you reassure them and you show them that it is treatable and there are many patients in PCOS with children, we are relieved. I always emphasize to my patients, if you are scared of that and all the consequences of PCOS, then the basic treatment is really lifestyle.
So it really does affect, it can have an effect on the mental health because as we mentioned earlier on the show, stress is one of the risk factors as well. And stress and anxiety worsens PCOS, and PCOS worsens stress, anxiety, and depression. So it really goes both ways. Dr. Sonia, how can women living with the condition manage PCOS as well as the impact that it may have on their mental health?
The stress of the pandemic and staying at home, gaining weight, women with PCOS are not getting their period. So always we tell them, now you have to start exercising, watch what you eat, and there are many medications that will help them menstruate. And that coupled with a healthy lifestyle and weight loss, the symptoms of PCOS will usually resolve or improve a lot.
It's common for women to find out that they have PCOS when they have trouble getting pregnant. But it often begins soon after the first menstrual period, sometimes as young as 11 or even 12 years old. And it can also develop in your 20s or your 30s. When we return, we'll debunk some myths about the condition. So keep it here on MedTalk Health Talk, only here on CNN Philippines. Around 10 million women worldwide suffer from PCOS, which stands for Polycystic Ovarian Syndrome. Now, the symptoms of this hormonal disorder vary from one person to another, but experiencing one of its hearsay signs doesn't necessarily mean that you have it. So here are the most common misconceptions about PCOS. I'm Dr. Freddy Gomez, and welcome back to MedTalk Health Talk. We're your partner in healthcare. I'll start with you, Dr. Sonia, with regards to debunking some of itong mga common misconceptions. One of them is nagsasabi na kapag naka-miss ng menses or ng period ang isang babae, ito ay automatically na meron siyang PCOS.
Well, number one, that's not true. Now, there are many causes of irregular periods, and PCOS is just one of them. So you have any hormonal imbalance, stress can give you a hormonal imbalance. No, you could be pregnant. You could have problems with your thyroid or your prolactin. No, so all of these are other causes of irregular periods, and it's not just PCOS all the time.
Okay. Now, another misconception about PCOS that I'd like to talk about is how it causes infertility among women. But actually, women living with the condition, with PCOS, can have a healthy pregnancy. Dr. Sonia, is this true?
Yes, that is very, very true. Women with PCOS, they usually don't have any problems with their ovaries. The eggs in those ovaries are very normal. So it's just a problem of irregular ovulation. So they don't ovulate on a regular basis. And usually, we just need to give these patients medications to help them ovulate, and they become pregnant quite easily.
Yes, so if you want to have yourself checked for PCOS, you should see an OB-gynecologist or an endocrinologist to better assess you and find out the root of the problem that you're facing. Dr. Jeremy, why is this important? Why should someone really get the truth about the matter from their doctor?
When we see these patients, we do a general checkup of these patients. The history is going to be important. The familial history is very important. Of course, we're going to work up for metabolic disorders. We're going to check the BP as well as the other parameters, the blood sugar, cholesterol, and all the other metabolic components that may be present in these patients. As I said earlier, they're really at risk for metabolic disorders. And, there's really that link that puts together your metabolic disease and your PCOS. And I think we'll cover that a little bit later.
Yes. Now, early in the show, we discussed that women with PCOS have higher levels of male hormones or androgens. And this can make ovulation a little bit more challenging, which then causes irregular periods, maybe acne, excess hair growth for that matter. Now, it also increases the chances of developing other serious health problems. Dr. Jeremy, you touched about this a little bit earlier, but let's remind our viewers, what are some of the complications that can happen with having PCOS?
So the problem with PCOS is really it's a mix of metabolic disorders. The key words that you want to remember when you have PCOS is insulin resistance. So if you're insulin resistant because you're overweight, you're diabetic, that is closely linked to PCOS. In fact, chances are sometime in the future you may develop diabetes, and therefore you really have to struggle to control your blood sugar as well as control your weight. So these are things that you need to look at.
You mentioned about diabetes, but high blood pressure is another common medical condition here at home that may be aggravated by someone with PCOS. Dr. Sonia, how can PCOS contribute to this? Anong connection ng PCOS and someone's blood pressure?
Patients have to understand that PCOS is a syndrome na at one end, you have polycystic ovaries, irregular period, and at the other end, later on in life, it's hypertension and diabetes. Patients with PCOS are more prone to developing hypertension when they are pregnant, just as they are more prone to developing diabetes when they are pregnant. And they're also more prone to developing hypertension and diabetes when they are older.
Mm-hmm.
So how to prevent that? Again, it's lifestyle and screening by your doctor.
So, Dr. Jeremy, if they address their PCOS, will it also address their diabetes? Will it also address their hypertension? Or can all these different metabolic problems be independent from PCOS?
I agree with Dr. Sonia earlier that the workup should not be one-dimensional. Often you have to look at it in a bigger picture and see that these patients, even as stable as they seem, may develop a lot of complications brought about by the initial problem, which is PCOS. And therefore, the screening process is pretty much extensive, looking at hormones, looking at different parameters. So to answer the question of whether or not you stop one, do you stop the other, really, if you're able to control and stabilize this patient early on, there's really a possibility that you're able to deal with the problem. So if you have PCOS, you keep this patient in a good weight, not overweight, not obese. You can help them get pregnant. So really, it is a lifetime disease as well. So this one will need a lot of counseling. We need to discuss with the patient really the impact in terms of their lives, how PCOS will affect them.
The types of treatment for PCOS may depend on whether or not a woman plans to become pregnant. More on this when we come back. We want to be your partner for a lifetime of good health, so stay with us here on CNN Philippines. Polycystic ovarian syndrome is a lifelong condition, and each case is unique, so treatment usually depends on the symptoms a woman is experiencing. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk, where your health comes first. Dr. Sonia, could you walk us through what the typical or what a treatment plan looks like for someone who wants to have a baby but is diagnosed with PCOS?
So when the patient wants to have a baby, then treatment is directed towards that end. So any treatment for infertility is done against the background of the lifestyle modifications that we talked about earlier. So, and usually when patients want to have a baby, they give them medicine to make them ovulate. And there are many drugs now that can help them do that. Some of them would be clomiphene, letrozole, and even have the injectable gonadotropin, which we use usually for IVF cases.
Now, if diagnosed with a condition, we want to stress that there's no reason to believe that it should negatively impact your life, because treating PCOS usually starts with making healthy lifestyle choices. Dr. Sonia, let's talk about that. What should one do? How should they be healthy?
Number one, exercise regularly, maintain a normal body weight. They must watch what they eat because they are prone to hypertension and diabetes.
Now, Dr. Jeremy, if a woman with PCOS does become pregnant, she's able to go through that, does she run the risk of having any of these gestational diabetes, maybe hypertension during her pregnancy?
That's really true. So these patients, as I said, they're already a pre-diabetic state. So a lot of these patients we follow closely whenever they go into pregnancy already. As they go into pregnancy, we know that they're already considered high risk, and therefore we should watch them closely. So some of these patients develop early on these manifestations of hypertension as well as gestational diabetes, or for that matter, pre-gestational or overt diabetes in pregnancy. And therefore, this will entail a closer follow-up as well as closer, more aggressive treatment for these patients during their pregnancy.
Dr. Sonia, you have something else to share.
That's a good question. We actually my society, the Philippine Society of Reproductive Medicine, actually just finished writing the new clinical practice guidelines for PCOS. And PCOS in pregnancy, we really have to advise these women that they are at risk for complications. There's a greater chance of preeclampsia or hypertension in pregnancy, development of gestational diabetes mellitus. These women are also at increased risk for delivering by cesarean section rather than normally. Also, their babies are at increased risk for growth problems, not just the classic too large babies, but also some of them can be growth retarded.
Dr. Sonia, what can you advise our viewers out there, especially those who are diagnosed with PCOS or who are unsure that they probably might have PCOS?
Say what I usually tell my patients, that PCOS is a lifetime lifestyle disease, but it's very treatable, and mainstay of treatment is the lifestyle modification, and we will treat your symptoms as they appear. Many patients will have healthy lives with many children.
Yes, very true. And Dr. Jeremy, do you have a message for our viewers, especially when it comes to PCOS?
Yes, I have 3 L's for our patient. First, PCOS is life-centered. Ibig sabihin, you have to live life. So if you do have PCOS, it doesn't mean it's the end of the world. We have to give hope to these patients that, you can go on with your life. You just have to be careful with the choices that you make. The second L is lifelong. This is a lifelong treatment that you have to keep in mind. It's not going to go away in a couple of weeks. And of course, the last one, Dr. Sonia said this, lifestyle disease. So ito po yung the choices you make with the food, the exercise, the weight issues, all of these needs to be taken into consideration. Don't lose hope. We can actually help you. A lot of people can help you. We're putting in a lot of effort to educate people about PCOS. It does not choose if you're rich or if you're poor. It can occur in childbearing age for a lot of people, and therefore you need to get help if you are diagnosed with PCOS.
And we want to remind our viewers that many women living with PCOS have gone on to have successful pregnancies, as what was mentioned earlier. And the treatments available ensure that women with PCOS live healthy and happy lives. With that, I'd like to thank obstetrician gynecologist Dr. Sonia Desquitado and endocrinologist Dr. Jeremy Robles for guiding us on this topic today. I'm Dr. Freddy Gomez, and we'll see you again next time. Stay safe, everyone.